From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresko. The month of May recognizes mental health awareness. There will be many local, state, and national events designed to bring awareness to the challenges faced by millions of Americans living with mental health conditions. According to the National Alliance on Mental Health, 1 in 5 adults in the U.S. have experienced a mental illness, with nearly 5 million people unable to access needed care. Today on 22 News in Focus, we'll be talking with several local organizations that offer services and programs for individuals and families in need of help. Joining me first is Kim Lee, Chief of Creative Strategy and Development at Mira Vista. Thank you, Kim, for being on our program today.
Thank you. Thank you for welcoming me.
Of course. So let's get right down just to the basics here. What is Mira Vista and what types of mental health services and programs do you offer?
Sure. So Mira Vista Behavioral Health Center is a large standalone inpatient mental health facility located here in Western Massachusetts, quite specifically in Holyoke. And we provide care for thousands of individuals each and every year who are looking for treatment for severe mental illness. So we are an inpatient psychiatric behavioral health hospital for adolescents who are between the ages of 13 and 17, 18 if still in high school. And then we offer an additional 80 beds for adults as well. And yet, in addition to all of our inpatient mental health programs, we're providing outpatient substance use treatment as well, because as we know, so often is the co-occurring diagnosis with substance use and mental health that the two can very often go hand in hand. So being able to treat one and being able to treat the other is quite a benefit at Mira Vista.
Now, Mira Vista has recently expanded with new adult inpatient treatment beds and the newly reopened 16-bed adolescent unit. Why the expansion? Was it necessary?
Absolutely based on need, absolutely based on community input, provider input, individuals who we know are, especially the adolescent population, who may still be boarding in emergency departments around the state, which is important to mention in that while Mira Vista is certainly located here in Western Massachusetts, we are a statewide resource available for families and individuals from throughout the Commonwealth of Massachusetts. But most definitely the decision for us to expand at the availability of adult beds was absolutely based on community need.
May has been designated as Mental Health Awareness Month. We are obviously in the month of May to bring awareness and understanding to many facets of mental illness. There are many facets of it. How important is it to talk about mental health? I'm sure a lot of people are scared to even admit that they are dealing with some sort of mental health issue. How important is it to get that word out?
It's extremely important, and May being designated, to your point, as Mental Health Awareness Month is a great opportunity for us all to re-emphasize, to reaffirm our commitment to talking about mental health and to creating communities where stigma is not dictated by silence and individuals feel comfortable talking about how it is that they're feeling. You know, we really don't have concerns when we talk about how our back hurts or how our stomach might be upset. But when it comes to how we're feeling, I'm feeling anxious, I've got some depression that I'm dealing with, those conversations are not as free-flowing as they are when it comes to our physical health. So having the opportunity, having a month-long recognition and observance of the importance of talking about mental health is very important.
Yeah, there is a huge stigma surrounding mental health. If someone is worried or scared or concerned to voice that, what do you recommend to encourage them to speak about it?
You know, it's interesting. My husband and I have 2 children, although they're not children, they're grown. But when they were younger, we would engage them in a conversation very frequently, and we would elicit how they were feeling emotionally with just 3 words, which were, "How are you?" So just the simple phrase, the simple question of "How are you?" really can begin a very thoughtful dialogue around how an individual might be feeling emotionally.
And I'm sure that builds a bond, right? Not only your relationship with your husband, but the kids as well, right?
Absolutely. And in those living room conversations that we had when we asked those very, simple question of how are you, it really did engage us as a family in an opportunity to talk with them about how they were feeling emotionally, just as freely and openly as they talk about how they're feeling physically.
How can communities, employers, workplaces foster a supportive environment for those who may be dealing with mental health challenges?
It really comes down to information and education. We talk a lot at Mira Vista Behavioral Health Center about the importance of engagement as well as education. Engaging CEOs, engaging HR professionals, engaging school committees, engaging school communities, churches, synagogues, in open dialogues around the topic of mental health and the importance of encouraging a stigma-free community where individuals feel comfortable and confident talking about how they're feeling.
We are in an age where everyone uses technology, whether it's your phone in your pocket constantly, on the computer, on your tablet. That has to have a major effect on your mental health. Time away from that technology, how beneficial is that? Hugely important. From a young person's perspective, it's important to give them an opportunity to just give their brain, their mind, a chance to experience moments of rest. That eagerness when that bell rings or that buzzer or that tone, who's been texting me, or what am I missing out on? There is a new phrase in that demographic, which is hang out and hang up, which put the phone down and enjoy the company that you're with. And taking time away, whether you're an adult or an adolescent, but turning off the TV, enjoying quiet music, picking up a book, but giving yourself an opportunity to just reframe how it is that you may be feeling emotionally. There can be an awful lot of negative news. There can be an awful lot of anxiety that's created because of that negative news. So it's okay to just hang up and hang out. Also, those phantom buzzes, you think your phone is ringing or buzzing in your phone, and it's actually not. We're so used to feeling that. So
very much so, exactly.
Getting rid of that technology for a little bit, obviously very helpful. Also getting outside as well. Earlier this week, we had such nice weather. Sunshine does wonders.
It absolutely does. Getting out, walking in the park, enjoying time with family and friends, doing yard work, just taking the opportunity to soak in the sun, to soak in nature, and to change your frame of reference. So again, going back to unplugging or reducing your screen time, turn the TV off, open up the front door, go out and enjoy your neighbors, enjoy some connectivity that you might discover while bringing your dog to the dog park. But those social connections and that opportunity to feel less isolated can really occur much more frequently when you are outdoors and in the environment.
Food also plays a major role in mental health as well. How so?
It can. There are many people who may be affected by an eating disorder, or they may not have a positive relationship with food. And so overeating, undereating, or eating the wrong types of foods. For myself, for example, somebody who has most of her adult life have had anxiety. I know there are foods that I need to stay away with. For example, caffeine or chocolate or things that might not be overly positive for me because of my diagnosis of anxiety. But actually on Mira Vista's website, if there are viewers who are interested, we do have a resource titled Eating for Good Mental Health. So I would encourage your viewers to visit our website, take a look. There's a lot of positive information to be learned and to benefit from.
Yeah, sometimes it's hard to stay away from that cup of coffee, but obviously much needed for some people. There is a list of the number and website on our screen right now. Now, some of us feel as though we have to be always doing something, filling our days off with events, house and yard work, as I did earlier this week. Try to get everything done. How important is rest, taking real downtime, and of course, sleep?
It's very important. Giving ourselves, first of all, giving ourselves permission to have that downtime is incredibly important. And most of the time, the stress that we may feel can often be self-induced. You know, it's that feeling of having to move faster, having to be more of this or having more of that, but really allowing yourself the opportunity to just begin to say no, so that you're able to open up more time in your schedule for you and for self-care.
Got to catch those Z's. Kim, thanks. All right, Behavioral Health Network has been serving the Springfield area for nearly 90 years. We'll learn about their programs after the break. We're back now with 22 News in Focus. The Behavioral Health Network was founded back in 1937 as the Child Guidance Clinic of Springfield and has grown to include multiple mental health services in Hampden, Hampshire, and Franklin counties. Joining me now is Christine Edwards, Director of Clinical Quality for Behavioral Health Network. Thank you, Christine, for being on our program today.
Thank you so much for having me.
So let's start with what types of emergency services does BHN offer?
So BHN offers a variety of emergency services from mobile crisis interventions where we go out into the community both for adults and for children. We also have respite programs, and we have a program called the Living Room, and we also have trauma response and then a 24-hour hotline.
It seems like nowadays mental health, at least people talking about mental health, is increasing. Are you seeing an increase in demand?
Yeah, we have seen quite an increase. I think the demand's always been there, but what we've noticed is that since the pandemic, the demand has remained high because people don't have the same supports and resources that they're used to. So what we've noticed now is that we are able, with our CBHC, our Community Behavioral Health Centers, we're able to get people in more quickly and access the services that they need.
What does a stabilization plan include?
So a stabilization plan is something that we would create with an individual to help them identify supports and resources that they might need to help either keep them at a level where they are safe or help them get back to a level where they can be safe.
I believe you mentioned Living Room.
Yes.
What is it?
So the Living Room is a program that we have in Springfield, on our Springfield campus. It's a 24-hour program for individuals who are struggling with behavioral health or substance use challenges, and it is a peer-supported program, so they can come in and connect with peers who have lived experience, and it helps them keep from needing to go to the hospital or to an emergency room.
As most of us know, mental health doesn't take a day off.
No.
Do you offer 24-hour care?
We do.
Okay.
We do. Our crisis services, all of our crisis services are 24 hours, and then a variety of our other programs are also 24-hour programs.
Now, substance abuse continues to be a problem all over the country, especially here in the state of Massachusetts. What types of recovery services do you offer?
So we have the full continuum of recovery services, from what we call ambulatory or outpatient or community-based services, as well as residential level.
And are you seeing an increase in demand with that?
I think similar to with our behavioral health challenges, the demand is there. And with our ability to get people connected to the right service at the right time, we're able to kind of help mitigate things escalating as they may have in the past.
You mentioned the COVID-19 pandemic. Obviously, things have gotten a lot better since 2020. What are some factors do you think played a role in COVID-19, the pandemic, everything closing down, and mental health?
I think people were forced to isolate and not be able to go out and connect with friends, family in the same ways that they used to. And so there was a significant increase, I think, in a lot of anxiety and depression. And so not being able to access the coping skills or the resources that we might have relied on before has really contributed to that being sustained at this point.
You also offer counseling and wellness services. Are both individual and group counseling available?
They absolutely are, for the whole spectrum from kids to adults.
And how does someone go about making an appointment?
So you are able to either call our main number, which is 413-301-WELL or 9355, or you can walk into either of our community behavioral health centers in Springfield and in Westfield. And then we have mental health centers in Agawam, Ware, and a few in Holyoke.
And then information right now on your screen, including the phone number, as you just mentioned, and the website as well. What about services for families who may be struggling?
So we have another spectrum of services that are community-based or wraparound. They're known as our CBHI, which is Children's Behavioral Health Initiative, and those work with, as well as early intervention and therapeutic mentors. So we have services that will work with families in their homes, as well as they can come into our clinics and receive family support there.
You said the demand is there, especially for children.
Yes.
What can children do, or at least what can parents do to help their children who may be dealing with some type of mental health problem?
I think one of the first things that you can do would be to acknowledge and normalize it, and recognize that it is completely normal for anyone to struggle, and to help them take the step to get supports. It can be a lot easier to talk to somebody that you're not related to, and be able to kind of share what's going on for you, whether it's at home or at school. And so we have lots of services that are in the schools as well, since that's kids' primary.
Right, I can only imagine how difficult it could be for a child, especially a young child, to voice their concerns about how they're feeling, what they're feeling. How important is it for parents to talk to their children about how they are feeling?
It's critical. It's absolutely critical. The more that parents can talk with their kids about how they're feeling or what might be going on for them, and to recognize that for kids, behavioral health struggles show up differently than they do for parents, is really, really invaluable, because for kiddos who don't often have language, that you're going to see it more in behavior as opposed to like, I feel sad. They might, have a tantrum, and for parents to be able to recognize that is really crucial.
What types of programs are available for persons with developmental or intellectual disabilities?
So we have a slew of programs through our developmental services line of care that go from 24-hour level supports all the way to individual therapy. We also have Camp for Kids. And so people can reach out to us, and we can get them connected either directly through our main number or through DDS, the Department of Developmental Services, can also get them connected.
Technology and methods for treatment is always changing. Of course, technology is always getting better. For the good, how does the BHN Center for Education and Professional Excellence help professional development, and who can participate in that?
So we affectionately call it the center because it's a long name. The center is a really robust team of people who offer trainings for our staff as well as for the community in a variety of topics, and we try to accommodate different learning styles and needs as adult learners, as most of our staff are, as well as community can reach out to us to request any type of topic that they might be interested in having a training, and we'll do our best to accommodate those requests.
And again, if somebody wants to reach out to you, how can they do so?
The best way would be to call 301-9355 or 301-WELL, or you're always welcome to walk into any one of our locations, and we will assist you.
Okay, again, the number and website on your screen right now. Some very important and some great information, Christine. Thank you.
Thank you so much.
All right, the Center for Human Development has been helping people in our region for 5 decades. After the break, we'll be talking about the mental health services they provide. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today's topic is on mental health services in our region as part of Mental Health Awareness Month. For the past 50 years, the Center for Human Development has been providing services to individuals and families struggling with hunger, homelessness, and health care needs. Since its inception, CHD has grown to multiple locations right here in Western Massachusetts and over the state line in Connecticut, expanding their programs to address the varying needs of communities. Joining me now is Ben Kraft, Vice President of Community Engagement for the Center for Human Development. Ben, thank you for being on our program.
Great to be here, Nick.
All right, so right down to the basics here. What is CHD and how many locations do you have?
Yeah, so we started in 1972 with a small group of folks who we like to think of as revolutionaries, sitting around a kitchen table, talking about changing the notion of how we provide care and support to people with mental illness, taking them out of what at the time was the norm, which was more institutionalized settings, and really enabling them and empowering them to live in the community and participate in the community. And that's really been a founding principle for us all the way along. So as we've grown and expanded over the years, we're now over 2,000 employees with a suite of services that goes all the way from Western Connecticut up to the Vermont border in Orange. We've held those values true, and we believe that helping people thrive and participate in the community is such a core contribution that we make in all of our programs, which are now numbering over 80.
I believe I mentioned some of these off the top, but we are focusing on mental health, but what other services do you provide?
Sure, we really like to help people at all phases of life and meet them where they are, no matter what the sort of challenge they're confronting. So starting with very young children who receive early intervention services, kids ages newborn to 3 who may not be hitting developmental milestones, who need a little extra support in hitting those milestones. We're doing that and seeing really good impact through kids and adult outpatient behavioral health services, a very large network of residential programming with people who have mental illness, who may have recovery challenges, who may have intellectual developmental disabilities across the region. As well as we have the Cancer House of Hope, which is a program a lot of people are familiar with, which provides outpatient counseling and support to people dealing with cancer, which unfortunately is affecting a broader swath of our communities. I could go on and on, there's a lot there, but really a wide range of services helping a lot of people.
What types of emotional and behavioral health programs are available, and are you seeing an increase in demand for those services?
Yeah, I appreciate your focus on that because we are absolutely seeing an increase in demand. We have outpatient services, which is a clinic ambulatory setting. We also have some residential programming, and that can really range. The length of stay can really range from a few days, people who are struggling, who have some challenges, who may need some respite time, to longer stays of weeks up to months. I appreciate the talk about stigma. I think the stigma challenge remains very real. I also think it's good to report that I think we've actually made a lot of headway on stigma, and that I think people are really starting to feel more comfortable reaching out and accessing behavioral health services, recovery support services. I think the real work we need to do now has to do with the issue of access. I think unfortunately a lot of people in the community have come to think of access to such services as being unattainable, very difficult, and have come to expect to be on a waiting list, to expect to have to wait or not get into services. The reasons for that are complicated. They have to do with insurance. They have to do with historical underfunding of behavioral health services. So CHD is really very laser focused right now on enhancing access. We are expanding our clinic services in Hampshire County with a large outpatient center in East Hampton, right downtown. We are developing a new child and family focused clinic in East Longmeadow, right outside the Rotary. And we've expanded our Park Street clinic in West Springfield that is now also going to be offering some primary care services. So understanding that mind and body are very closely related in terms of people's health, we really want to be helping people on the physical health as well.
We mentioned that word stigma several times in this broadcast. Do you think there will ever be an end to the stigma?
I don't think we'll ever be able to say we've defeated it, but I have to say we've come a long way, and I think when you have prominent people who have become much more comfortable speaking publicly, whether it's sports figures or celebrities, elected officials, talking about some of those challenges, it becomes more normalized. And one of your previous guests talked about making it normal to understand and recognize, name these challenges. I think we've come a long way, so that's why, again, people are ready to get help. We want to make sure they can do that.
You mentioned access to help at least try to end the stigma. Anything else that you think would move forward to trying to end that stigma around mental health?
I think the more we can expand services available, the more it becomes normal for people to be able to talk about it and be comfortable, because something that's commonplace, right? Something you see all around you. I know, I have a teenager, and I know the conversations I have with her about mental health are a far cry from anything that happened when I was in high school, back in the dark ages. And I think it is present in their lives. I think it is something they talk to each other about. And I think that's a great step forward.
Do you offer both in and outpatient options, and what do they include?
Yeah, so inpatient is a very specialized type of service. Kim talked about that earlier. Really, most of our services are on an outpatient basis. So that's meeting and really coming together to a goal for your treatment. What are you trying to accomplish? What are the expectations for communication? What are the expectations for timeline? What is particular about you as a person, about your family situation, that will enable us to build a very specialized outpatient treatment plan that can not only encompass therapy, but can also encompass things like medication. We have a lot of capacity to provide medication, which is not a universal solution for everyone, but can be very helpful for people. So medication services, peer services, talking to people who have gone through similar experiences, and individual and group therapy are all options for CHD.
Out of the many services you do offer, you also offer addiction recovery programs. What do those programs include?
Sure, we include a lot of residential services for addiction recovery, and I think one of the distinguishing factors about my organization, something we're proud of, is that we can address specific demographics. We have a program for adolescent boys. We have a program for mothers with young children. So we can put people in settings where they have many peers or people with common ground among them, and they can really work together on their recovery challenges.
What about crisis intervention?
Yeah, so CHD operates a community behavioral health center, which we call Gateway, that is serving the Holyoke Chicopee region and those surrounding towns. One of the things I wanted to touch on is the issue of co-response with law enforcement, which is certainly crisis response, and some co-response activities fall into that category. So we now have clinicians riding with officers in many communities and enabling officers to spend more time doing real police work, which is their specialty, of course, and letting those mental health challenges fall into the hands of the clinicians who can handle them, which really is a better solution for everybody, getting people the support they need on the ground in real time.
Of course, not only adults are dealing with some type of mental health issue, but kids, especially our kids, are as well. What types of child development and advocacy services are available? Yeah,
kids have had a hard time, and there's been a 30% increase in anxiety and depression among kids and adolescents over the last few years. As you probably know, the White House declared a child mental health crisis a couple of years ago. So we have counseling services available for kids. I mentioned a new Kid and Family Focus Center coming online in East Longmeadow. Certainly advocacy is an important piece of that. So CHD operates CASA of Hampden County, who are volunteers who work in the court system with young people who have gone through very difficult circumstances, and really serve as a guide and a friend to them and a navigator for them as they go through some very difficult things in the court system. And we always need people to volunteer for CASA, so I would certainly encourage people to check that out.
A lot going on in the world, of course, that causes anxiety, depression. Are you seeing an increase in kids dealing with some sort of mental health problem?
Yeah, absolutely. I think kids have had a really hard time, and I know, thinking about the realities of being a kid these days, where you really can always be connected to your phone, always have your nose buried. You lose those more social interactions that are so important for kids learning to be healthy and thrive. We're absolutely seeing an increase in demand for services, which again is why we're trying to respond by building capacity, both on the professional level. We're really looking to hire more people who have that kid focus, as well as developing new facilities such as the Prospect Center in East Longmeadow, which is really going to be all about kids.
And we have some contact information for the Center for Human Development right now on your screen. There is the phone number as well as the website. Anything else, Ben, that is worth mentioning?
No, I really appreciate the work you're doing this month and the work that 22 News does really all year round to sort of shine the light on these very important issues. So thanks so much for having me today,
Of course.
Nick.
Ben, thank you.
Great.
Well, lack of mental health education and access has been shown to be an issue in underserved communities. We'll be talking next with Colorful Resilience, a counseling agency that is providing support. You're watching 22 News in Focus. We're back now with 22 News in Focus. Our topic is mental health services and programs as part of Mental Health Awareness Month. According to the American Psychiatric Association, racial, ethnic, gender, and sexual minorities often suffer from poor mental health outcomes for many reasons. They include lack of access to high-quality mental health care services, cultural stigma, discrimination, and lack of awareness about mental health. The disparity in access to vital health and wellness services can lead to a lifetime of depression, anxiety, and substance abuse. Joining me now is Mayrena Guerrero, founder and CEO of Colorful Resilience, which offers outpatient services to primary but not exclusively Black, Indigenous, and other people of color, LGBTQ+, first generation, and immigrant people. Long list there.
I know.
But it's needed.
100%.
Thank you for being on the program. I do appreciate it.
Thank you for having me.
Let's start with some background on Colorful Resilience. What was the reason for founding this practice?
So I'm a mental health counselor. I was in community mental health, and then I opened a private practice for 6 years. And even though I specialize in cognitive behavioral therapy for the treatment of anxiety and depression, I noticed that the same people gravitated towards me. Always people of color, immigrants, or members of the LGBT community or first gen. And I believe it's because I am very open about my identities and intersectionalities. And so people felt more comfortable receiving services from people that had shared lived experiences. So then the pandemic happened. And my phone used to ring 3 times a day, and suddenly it's ringing 20 times a day. And I'm like, where am I gonna send these clients? I am full. And I understood that there was a hole in the market. There was not a place that was specifically to deal with the needs of these communities. And so Colorful Resilience was born.
Are you seeing an increase? We've been talking a lot about increases in demand for mental health services. What about you guys? Are you seeing an increase in demand, especially after the COVID-19 pandemic?
Yes. At the same time that the COVID-19 showed a huge disparity in services for the various communities that we work with, we also noticed that the Black Lives Matter movement was present and had a huge impact on the Black community. So their need, or the realization that mental health services were needed, became bigger. And so yes, we have a wait list. People are knocking at our door. We hardly advertise because they're looking for culturally competent services.
Is there a shortage of representation of LGBTQ+ communities in the outpatient mental health workforce?
Yes, there is.
And why?
It's very unfortunate.
Yeah.
I think it's because these communities, the BIPOC, LGBT, first generation immigrant communities, are communities that have always been at a disadvantage, right? So then say you have somebody that went to grad school and graduated. That's the first person in that family, and it's already a huge accomplishment. Like, it would be bigger if they went for their license and now they're a licensed independent clinician. But they celebrate a small accomplishment, and it's hard to move to the next step, and they don't necessarily have the support from their place of work or a community that will push them forward. So there's not a lot of licensed clinicians in our communities, but that's something that we want to help. Mm-hmm. We have an internship program because we're trying to nurture clinicians of color and clinicians who are immigrants and members of the LGBT community to go on to be licensed and eventually end up in private practice like they deserve.
What is the impact from the lack of cultural competency when working with these specific communities?
Well, the problem is that if a lot of the needs are for these communities and the people providing the services are white clinicians, white heterosexual clinicians, there's no there's no understanding of the day-to-day realities of their existence. And sure, you can read, you can be educated about it. However, there's something about shared lived experiences. Also, there's something about mentorship and modeling that happens from having a person in authority, a clinician, a professional who looks like you, who sounds like you, who speaks your language. It's extremely powerful.
Now, the state of Massachusetts has seen an increase in migrants. We've been talking about it for months now on our local news channels, but also all across the state, many of whom don't speak the language or may have trouble adjusting to the American way of life. They also may have cultural bias toward mental illness and treatment. So with that being said, how do you address these issues when people come for help?
Yeah, that's actually a big problem in the communities that we serve. There's, many cultures, why go to a therapist? Why would you talk about your problems with a stranger? Why not go to a priest or talk to your grandfather or something like that? But, eventually, whether it is like it's a child or a teenager and there's like behavioral problems that show up at school and then they're kind of guided to seek services, or an adult that is like overwhelmed and really struggling at home or at work, eventually they find us. And the way that we approach this is with curiosity. Teach us about you, about your culture, about your reality in your household, as an immigrant, in this community of primarily white straight people. How do you navigate that? What are the problems that you're dealing with, and let us support you.
What are the challenges for first-generation children in dealing with two cultures?
Well, that is a tough one, especially because immigrants, they come here to have a better life. They come here to slay. So the demand on first-generation children is huge. Like the pressure is huge because they are the fulfillment of their parents' dreams, right? And it's hard to be stuck between two cultures. You're not American enough, you're othered in America, and if you go back to your country, you're the American, you don't belong here. So it's a really hard thing to navigate, and it's special flavor.
I want to talk about preventative mental health care. What is it? What is involved in it?
That's a great question. People go for a physical every year, correct?
Some do.
I hope they do. They should go for a mental health check once a year. As a matter of fact, I believe that was a law that was approved last year, where you are entitled to a wellness check for mental health once a year. Take it. Even if you don't think that you need a therapist, well, you're not a therapist. Right. Go find out from a therapist that you're okay, and seeing which other ways you can be supported. Here's the thing. There are many levels of care in Massachusetts when it comes to mental health. But if we allocate money, resources, attention, and power into outpatient level of care, then we prevent people from accessing higher, more expensive levels of care. So I would like everybody to have a therapist that they see once a week or once every other week, instead of having people flood the ER with mental health issues.
Big takeaway, get your physical. Very important.
Physical.
Very important. We have some information now on our screen, Colorful Resilience. We have the phone number right there, as well as the email and website. Anything else that you believe is worth mentioning? Anyone who maybe is interested in reaching out, what they should know?
Sure. All you have to do is go to our website. We have the About Us section. You fill out a form and it comes to us, and it's so seamless. You will hear back from us within 48 hours. One person is definitely gonna get back to you. We take all insurances, and we really make it seamless so that even financially, you will know before your first session if your insurance will cover it and what your financial responsibilities are. We really make it easy for the user or for the client to just access the care and have the best quality care possible. Did I mention that all of our clinicians are fully licensed and are representatives of the communities that we serve? Every single one of them.
Very important, and obviously you help out a lot of groups, so a lot of good information there. Thank you.
Thank you.
The Gandara Center has been providing bilingual health services for over 40 years. We'll find out more on that organization's mental health programs when we come back. You're watching 22 News in Focus. Back now with 22 News in Focus. The Gandara Center was founded in Springfield in 1977 to advocate and provide behavioral health services for the Hispanic community. The first location was a storefront on Main Street in the city of Springfield. Since then, the organization has grown to multiple facilities across the state and expanded programs for children and teens, housing, foster care, and other health services, in addition to mental health support. Joining me now from the Gandara Center are Enrique Vargas Gonzalez, Clinical Supervisor, and Lavon Claudio, Director of Family Support and Training for Holyoke and Springfield. Thank you both for being on our program today.
Thank you for having us.
A lot of important information to get to. I want to start with how important it is to provide culturally competent bilingual behavioral health services, and how does this approach differ from other health services?
Listen, culture is such a big impact on our mental health. Like, the idea of having somebody that represents you is key to what we do. And culture is a big subject. Like, when we think about culture at Gandara, we just don't think about ethnicity. We don't just think about language. We're thinking about the family's individual culture. Me being Puerto Rican, and what I eat or the language I speak is a big part of my culture, but my family's individual culture, that is very important to my family's mental health.
Now, because of cultural stigmas, many don't seek treatment for mental health issues. It's being seen all across the country. How are you reaching out to those underserved communities who really do need the help?
The biggest part about that is getting the clinicians and the outreach workers that know the community, that are connected to the community and have roots in the community. It's also making sure that we go to where they're needed. Where is the services needed at? Getting them at the point of that access to care, meaning we're going into the schools. We're meeting with the different principals, the counselors, to make sure when there is a problem that begins to arise, there is this pathway to make sure that they're getting the help that they need.
What about services for children? This program, we've been talking a lot about children and the focus on mental health. What do you provide for them?
So one of the biggest things we do is within our CBYCS, which is the Children and Youth Clinical Services. What we do is making sure that we have the services for them. This is anything from outpatient to intensive care coordination, in-home therapy, where a therapeutic mentor, family support and training, where we can use CBHI and wraparound to actually wrap services around the family, making sure that they have the team that they need and what they need to make sure that their youth and family feel supported and get access to the care that they need.
I want to talk about some of the mental health programs. You do offer outpatient and non-residential treatment programs. What is involved in outpatient treatment during recovery?
So, outpatient is a service that is provided for different populations, from children all the way to elderly people. And recovery is a process that can happen at the same time. So what is involved in outpatient can mean different things for different people, from counseling, regular counseling, to psychiatric treatment, medication, all the way to coaching or peer mentoring, or even residential programs that we also offer in the Gandara Center.
Once someone does complete the program, what support programs are there to help them keep on their path to wellness?
So something that Gandara offers to the Hispanic and underserved communities is a multidisciplinary team from all types of providers, medical providers, mental health clinicians, substance use clinicians. So what that means is that the person keeps going through different assessments and reassessments, and through that a person can be referred to whatever services they need after they complete a program or need to continue with other services.
The center does have several outpatient behavioral clinics. What programs and services are offered through those clinics?
So we offer from, again, individual, couples, family counseling. We offer psychiatric services. We do offer primary care physician services because we are a certified behavioral community clinic. So that means that we have to offer a comprehensive behavioral health services. We also have case management. We offer recovery support navigator services. And well, we also have the recovery coach program.
And are there programs for children and youth as well, and what are those?
So we have a range of different programs for youth and children. And a lot of that stems from our CBHI, which is the Children's Behavioral Health Initiative. And anything from a therapeutic mentor. So you think about that person, that peer that can help connect with what you are struggling with and put it into practice. Meaning that if a clinician is talking about you're having issues with anger management, then this therapeutic mentor can go out there and actually connect you with strategies and put them into practice within the community. We also have the Impact Center, which is a drop-in center for young adults who are couch surfing, who are experiencing homelessness, who can come in, connect with people who are right there, and be able to connect with any of the services that they may need, including finding a job, including finding a place to live. And we also have just the ability to come in, wash laundry, and get some food.
I want to talk about the Adult Community Clinical Services Program as well, one of the other programs and services you provide. Who is eligible for that?
So any person who's 22 years old and older can access if they have any type of developmental or intellectual disability. Depending on the severity, they can access different types of services. It's pretty much a wraparound person-centered program focused on skills development and community integration.
Gandara also has multiple substance abuse programs as well, recovery programs. Someone qualify for a residential, how does someone qualify for a residential recovery home?
Basically, you have to be 18 years of age or older. You have to be a resident of Massachusetts, and you have to be willing to go through an assessment and pretty much be ready for to start, a recovery process. Most of the people who start a recovery home or recovery residential program, they have to go through a detox process before they can join one of the residentials.
Is there a wait list for that?
There is not a wait list, and we actually try to place the person as soon as possible. In the case that we couldn't find a bed, because we are limited by the number of beds that we have, the staff is trained to help place the person in another program in Massachusetts.
And we have the contact information for the Gandara Center, both the phone number as well as the website. If somebody does want to reach out, how do they do so, and what else would you tell them in order to contact you guys?
I would say go to the website. All the services are described there. You can also call the phone number, and we will be very happy to offer any of our services to any of the any person in the community, especially the underserved communities and the Hispanic communities.
All right, lots of great information there. I'll have some final words after our short break. You're watching 22 News in Focus. You've been watching 22 News in Focus. Today's topic has been about mental health services and programs right here in Western Massachusetts, as well as Connecticut, as part of Mental Health Awareness Month. Thank you to our guests for sharing this life-saving information with us today. And if you missed any of the program, you can find it on our website at wwlp.com. That includes all of our organizations that were featured here today. Thank you for watching.